In this video, we discuss what is the best diet to fight cancer. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101 – Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. As mentioned in other videos, we now know what we should be avoiding most: glucose, glutamine, and methionine. But that still leaves a lot of room for variation in a diet. The two main diets that have shown the most efficacy against cancer are a vegetarian diet and a high-fat, calorie-restricted ketogenic diet. The advantages of a vegetarian diet are increased polyphenols from vegetables and increased compliance over a high-fat, ketogenic diet. The disadvantage is that a vegetarian diet will be consuming more carbohydrates, which convert to glucose, than the high-fat, ketogenic diet. Vegetarians have been found to have lower rates of cancer incidence than non-vegetarians. Vegetarians were found to have an 8% lower incidence of cancer, and vegans a 15% lower incidence. Other studies on vegetarianism have been even more positive. Yet surprisingly, once a vegetarian has been diagnosed with cancer, their chances of survival are not significantly better than a non-vegetarian. There have been no randomized controlled trials that show an overall survival benefit from taking a group of non-vegetarian cancer patients and putting them on a vegetarian diet. But the number and size of the existing trials are truly paltry. The Dean Ornish study profiled in another one of our videos showed that a vegetarian diet in conjunction with other interventions did improve cancer prognostics. We believe that a large, rigorous trial that put people onto the vegetarian diet who were not on it before would improve overall survival by at least 11%, the same amount that a vegetarian diet reduces cancer incidence. The high-fat, calorie-restricted ketogenic diet is the most promising anti-cancer diet. The normal methods of energy production within the body are oxidative phosphorylation and glycolysis, which use glucose to produce energy. A more efficient way of producing energy is ketosis, the use of ketones for fuel. When the body does not have sufficient levels of carbohydrate, usually about 50 grams a day, it begins manufacturing its own energy source, ketones, in the liver. Ketosis has been used as a treatment for epilepsy in America since 1921. Before that, in fact, even in the time of Hippocrates, fasting, which can be a way to induce ketosis, had been used as a treatment for epilepsy, but the epileptic seizures would return once the fast was broken. The ketogenic diet actually has a better control rate of epilepsy, over 70%, compared to conventional drugs, 65% or less. The ketogenic diet has also shown improvements in Alzheimer's disease, dementia, type 2 diabetes, obesity, metabolic syndrome, autism, migraines, and more. The ketogenic diet seems to be particularly good for the brain. This may be because the brain consumes so much glucose. Despite only accounting for 2% of the body's weight, the adult brain consumes up to 25% of the body's glucose. It can be as high as 60% in the developing brain. Brain tumors have an easy time obtaining glucose while literally in a bath of it. Ketones, which are the fuel source the body produces when in ketosis, cannot be easily used by cancer cells. So the ketogenic diet changes brain tumors from being awash in fuel to grow to being awash in something they cannot use efficiently. The ketogenic diet shows resounding success in animal models. A recent meta-analysis found that the ketogenic diet resulted in median improvement in overall survival of 21.7% in animals and dramatic decreases in tumor weight and volume. History. The earliest studies examining the effect of the ketogenic diet against cancer in humans were in the early 20th century in Germany. In 1927, Fritz Silberstein used a high-caloric, very low-carbohydrate diet along with insulin injections to lower blood sugar levels in 21 advanced, inoperable cancer patients. Silberstein observed beneficial effects on the patients, and some people responded with a local regression of their tumors. The next trial of the ketogenic diet in people with advanced cancer wasn't until 1942. Wilhelm Brüning administered the ketogenic diet along with insulin injections to 14 people who had no further treatment options available to them and who had tumors that could easily be measured by eye. Of the 14, 6, 43%, achieved a moderate remission, 7, 50%, an extensive remission, and 1, 7%, a macroscopic complete remission. Brüning then wrote another paper with 30 people where he didn't have as much success. Even in his first study, the tumors eventually returned. There is a significant possibility that this is because his low-carbohydrate diet relied largely on meat, and the tumors adapted to utilize glutamine as their primary fuel. Brüning's study could not be replicated by another set of scientists, and attention shifted away from the ketogenic diet's effect in cancer treatment. It has been noted that the scientists who attempted to recreate Brüning's results were less forthcoming about the foods they actually supplied to patients. Additionally, seeing as the follow-up study occurred later in World War II Germany, perhaps they were not able to access the same foods as Brüning. The next piece of scientific literature on the ketogenic diet's effect on cancer in humans did not occur until 1992 in the form of a case study. A 3-year-old girl with a spinal tumor was administered the ketogenic diet. To be more specific, she was given an MCT oil-assisted version of the ketogenic diet. 60% of her calories came from MCT oil, 20% came from protein, 10% from carbohydrate, and 10% from fat. She showed a 21% drop in blood glucose and exhibited significant clinical improvements. She continued the ketogenic diet for an additional 12 months, remaining free of disease progression. MCT oil is still often used as an adjuvant to the ketogenic diet. The next report of the ketogenic diet showing the ability to fight cancer was a case report from 2010. A 65-year-old woman with glioblastoma regressed for 8 months while on standard of care and a calorie-restricted 4-to-1 ketogenic diet, 4 calories from fat to 1 calorie to carbs and protein. The authors were quite surprised with the success of the woman. Then she broke her diet and progressed. In 2012, a study of a calorie-restricted ketogenic diet in 9 people with advanced cancer who had previously demonstrated rapid progression produced either stable disease or partial response in 5 patients in just 28 days. Ketone levels were 3 times higher in responders than non-responders, indicating that diet adherence plays a strong role in effectiveness of the treatment. A 2014 trial of 6 glioblastoma patients undergoing standard of care treatment concurrent with the ketogenic diet resulted in 4 patients being alive at a median follow-up point of 14 months. This is far beyond the norm. Additionally, the ketogenic diet patient's blood sugar averaged 84 milligrams per deciliter, while the standard diet participants' blood sugar averaged 122 milligrams per deciliter. Another 2014 study examined the effect of the ketogenic diet in recurrent glioblastoma. 12 of the participants achieved at least 1 urine test that showed they had entered ketosis. 6 of 7 patients treated with Avastin, a standard of care drug in glioblastoma, achieved an objective response with a median progression-free survival, no progressive tumors, of 43% at 6 months. The normal life expectancy in recurrent glioblastoma is only about 6 months, so this group outlived the average. In 2016, a study from Germany of 78 people with various types of cancer uniformly had better outcomes than people who did not switch to a ketogenic diet. A ketogenic diet is associated with improved cancer outcomes. A 2019 study of the ketogenic diet and in conjunction with other therapies demonstrated a dramatic benefit in 25-stage 4 pancreatic cancer patients. The benefit cannot be solely ascribed to the ketogenic diet, but the study is so remarkable it has to receive special attention. The patients received a combination of chemotherapy, hypothermia, and hyperbaric oxygen, in addition to being instructed to eat according to the ketogenic diet. Before receiving chemotherapy, the patients were instructed to fast for 12 hours. They were then given a shot of insulin, just like with Silberstein and Bruning nearly 100 years earlier. After the chemotherapy, the exact amount of time after is not given, patients received localized hypothermia for 60 minutes, then hyperbaric oxygen therapy for 60 minutes at 1.5 atmosphere pressure. The average overall survival was 27.4 months. The typical survival is only 3 to 5 months in stage 4 pancreatic cancer. Additionally, the 5-year survival rate was about 20%. The typical 5-year survival in pancreatic cancer is approximately 1%. So, this intervention represents a 20-fold increase over the standard of care. A chart showing the 5-year survival of the aforementioned patients, several other human trials demonstrating the efficacy of a high-fat keto diet during cancer treatment are summarized in Cancer Self-Defense 101. Also, please note that a ketogenic diet as described here is not high in protein, that is animal meat, but high in fat. A good resource for high-fat keto recipes is the Charlie Foundation. For more information on the vegetarian and keto diets during cancer treatment, see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.